Welcome, everyone. Welcome on behalf of the American Diabetes Association. I'm Dr. Bob Gabbay, the Chief Scientific and Medical Officer, and you have tuned in to Ask Dr. Bob, where you put in your questions and I look to answer them related to diabetes. And I want to wish everyone not only a happy Nutrition Month and also happy Women's History Month. And so, in honor of those two important areas, we have a whole slew of questions that have already come in that I'll start right away answering. At the end, feel free to add some more questions that we'll probably do next time because we already have so many questions right off the bat. So, without further ado, I'm going to start going through them. So, the first person asks, what is gestational diabetes? So let's start with that as a level setting thing. So gestational diabetes is diabetes that develops during pregnancy. Now, sometimes people can have diabetes before pregnancy, not know it, become pregnant, and then be diagnosed with diabetes. We usually don't call that gestational diabetes. Gestational diabetes happens during pregnancy, and it's usually in the third trimester of the pregnancy. So it's generally diabetes, that develops in around the third trimester of their pregnancy. So that's what gestational diabetes is. And then a great follow-up question the person asks is, how does that affect me and my unborn baby? And I'm very glad to be able to answer that question because it's important that we know that people have gestational diabetes because if left untreated, it can cause all sorts of problems. So it can cause problems for the mom during delivery. It increases the chance of preeclampsia and other complications of delivery. And it can affect the baby. The baby can be born much larger. It can have other issues associated with it. And so that's the concerning piece that, well, gestational diabetes can affect both mom and baby. The good news is that by the proper treatment and the proper management, you can prevent all of that stuff from happening in large part. And so it's important to get diagnosed to see if you have gestational diabetes during your pregnancy. And that's why we recommend screening women at around 24 weeks for whether they have developed gestational diabetes. Catch it early, prevent problems. That's true for a lot of stuff in diabetes when you really boil it down. So let me move to the next question. So how we're talking about gestational diabetes here for Women's History Month. So how common is gestational diabetes? Is this a rare thing, a common thing? Some of you may know people or may have had gestational diabetes. In general, it's about 6% of the population. But like many things in diabetes, there's certain groups that have a much higher risk. And African Americans, those of Asian ancestry, Pacific Islanders, Native Americans, Latinas, they are all at increased risk. So that 6% is across everybody, but those groups have an even higher risk. Next question is, does it always turn into type 2 diabetes after pregnancy? And that, so let me back up a little bit. So gestational diabetes, I said, that's diabetes that develops around 24 weeks. And most people, after they deliver, most women after they deliver, their diabetes goes away. But, and here's the big but, is that they are really high risk of developing diabetes later on. So the statistic we tend to think about most is of all women that have had gestational diabetes, half of them will develop diabetes in 10 years. The good news is, like a lot of things in diabetes, you can prevent that from happening. And we'll talk about that with some of the other questions. So you do want to be screened after delivery, and generally that's recommended within the first 90 days to be screened to see if you still have diabetes after delivery. And we miss that window very often. So it's challenging. New mom, baby. Oh my God, life is hectic. But go in to see your provider and get checked to see, did the gestational diabetes go away, or might it have continued? Because for some women, they still have diabetes after delivery. Okay, so maybe here's probably a helpful thing to think about. So why do women develop diabetes during pregnancy? What's happening there? And we don't have the full answer, but I'll give you the best explanation that we have scientifically right now. So what happens during pregnancy is that for all women, they become more resistant to the effects of insulin. Remember, insulin is the hormone that controls your blood sugar. And so during pregnancy, you become more resistant to insulin. It happens for everybody. Most women, their body just makes a lot of extra insulin and they have no problem. But some people can't make that extra insulin. Why does pregnancy cause insulin resistance? Why does it make people, make women less sensitive to the insulin their body makes? There are some hormones that are produced that make that during pregnancy that make one insulin resistant, and the placenta makes some of these hormones that cause insulin resistance, and that's why we think it happens later in pregnancy as the placenta has grown more and causes this insulin resistance. Not everybody gets diabetes, but a sizable number of women do develop gestational diabetes. Okay, let's move a little further now to the next question. And one of our viewers asks, do women experience diabetes different than men? How is it different? Well, in a couple of ways. A lot of it's very similar. The symptoms of type 2 diabetes are largely the same: excessive thirst, excessive urination. But women are likely to get vaginal infections, fungal infections. That's what's different. And it may affect their menstrual periods. So that could be a hint. That said, remember that most people with diabetes early on have no symptoms. And that's why it's important to be screened to see if you have diabetes, because you can't rely on your symptoms. What else would I say is different for women with diabetes? One important area, and it's an area that the American Diabetes Association has really been working hard on raising awareness, and that's around heart disease. So normally men have a higher risk of heart disease than women. Well, what happens is when women develop diabetes, their risk goes up significantly, and their risk of heart disease becomes like men without diabetes. And so that's why it's important for them to pay attention to the things that we know will prevent that heart disease. Having good blood sugar control, watching your blood pressure, your cholesterol, and maintaining a normal body weight. So all of those things are important. The next question is sort of following up on this difference between men and women, do their hormones have anything to do with this? Well, yes. We talked about the hormones during pregnancy that lead to gestational diabetes, but another area is, and some women with diabetes will notice this, that their blood sugar control varies with their menstrual cycle. Not everybody sees that, but a lot of people do, and you may have noticed that. Why is that? What's going on? Well, the menstrual cycle is sort of two main hormones, just to be simple. Obviously, it's a bit more complicated, but let's just keep it simple here. It's estrogen and progesterone. And the second part of the cycle, progesterone goes up. And progesterone also makes people insulin resistant. And so it makes them require, it can drive their blood sugars up. They may require more insulin during that latter part of the cycle. And so, yes, hormones have something to do with blood sugar control. But again, these things can be managed. You need to be able to have an understanding of the patterns and work with your provider to adjust treatment accordingly. Okay, moving on. Let's talk some about nutrition. We have a number of questions here in that realm, and it is National Nutrition Month. So when it comes to nutrition, do you think it's enough to prevent diabetes with just diet? Well, turns out probably not. Diet is very important. And I don't like to use the word diet because diet sometimes suggests that it's a temporary thing, like I'm going to go on a diet. When we talk about what people with diabetes eat, or people at risk for diabetes with prediabetes eat, it's really coming up with a meal plan that is long-term. It's not a quick fix kind of situation. And yes, their meal plan is really important, but exercise is also important. And there was a really large study that became the foundation of us understanding how we can prevent diabetes. So it turns out we know a lot about preventing diabetes. And this program called the Diabetes Prevention Program that you may have heard about, and the American Diabetes Association supports a number of these programs around the country, along with other organizations, in partnership with the Center for Disease Control. This diabetes prevention program that has been shown to work involves both changing in eating and exercise. And the exercise is not crazy amounts of exercise. What they had people do was exercise 150 minutes a week. So 30 minutes 5 times a day gets you to that 150 target. And if you do both the meal planning and the exercise, the risk of diabetes drops by 2/3. So it's really effective. Okay, let me move on. Do I need a nutritionist or is an endocrinologist enough? Well, that's a great question, and I am an endocrinologist, and I really do recommend meeting with a nutritionist, with a dietitian. They're incredibly helpful. They can tailor a meal plan to what works for you, because again, this is not a sprint, this is a marathon. And thinking about what you like to eat, and then molding that in a way that is healthier is going to be effective. Endocrinologists could do some of that. Often they don't have enough time. They honestly don't get the same training that nutritionists. They're experts in nutrition. So I really do encourage people seeing a nutritionist whenever that's available. And you should ask your provider about how you can connect with one. The next question gets back to pregnancy, and it's a little more specific, but I think it's an important question to make sure we all understand. So this woman says, I'm 6 months pregnant, and so congratulations. Can taking insulin hurt my unborn baby? And let me be very clear. Absolutely not. Insulin for many women during pregnancy is the best treatment to protect your baby. So don't be afraid of taking insulin if you need it during pregnancy. It's been studied for years and years. And if you need it, not everybody does, but if you need it, it's the right thing. And it will actually help you and help your baby. Okay, let's move on. I was diagnosed with gestational diabetes during my first pregnancy. How likely is it to develop again during my second pregnancy? So first I said that 50% of women who have gestational diabetes will get diabetes again, full blown, so to speak, more permanent diabetes, type 2 diabetes, within 10 years. That said, if you had gestational diabetes during your first pregnancy, there's a really high chance that you will have it again during your second pregnancy. Not always. There are things you can do, again, to make sure that's less likely. And one of the things people often don't think about during pregnancy is, for many women, again, talk with your obstetrician, some degree of exercise can be helpful. We don't often think of women exercising during pregnancy, but many times that is safe and appropriate. But again, check with your doctor to make sure that they recommend that for you in your particular circumstance. And then I have another question. What can I do prior to getting pregnant to prevent gestational diabetes? What can I do? The best thing you can do is work towards a normal body weight. And so if you are overweight, or if you have and or obese, losing some weight will really lower your risk of developing gestational diabetes. And then working with your obstetrician to not gain too much weight during your pregnancy. Obviously, pregnancy involves some weight gain, but doing that in moderation. And again, they can guide you with that to make sure that you do it in a safe and helpful way. So let me see if we have other questions here coming in. We've covered a lot of different ground. Here's one. Does menopause increase the risk of type 2 diabetes? It's a complicated story, and the short answer is it may. And teasing that out is tricky, in part because many women gain weight during menopause, and we know that gaining weight increases your risk of developing type 2 diabetes. Could there be other reasons? Maybe. It's not 100% clear where we are. Another question. I'm gonna just do one last one because I think it's important that, honestly, now we talk about this at every time we all get together, and that is get the vaccine. If you're pregnant, speak to your obstetrician. If you're not pregnant, get the vaccine. I can't be more clear on that. I've gotten it. I've encouraged all of my patients to get it. Sadly, there's some misinformation about there. We recommend, along with the Center for Disease Control, get the vaccine. I know it's not available to everyone right away. Be patient, but when your turn comes, please take advantage of that. We want to save things for us. So with that, I want to thank you for another great session of questions from all of you. Throw any other questions in the chat. We'll try to answer them next time. And on behalf of the American Diabetes Association, Dr. Bob Gabbay, thanking you for joining Ask Dr. Bob.